Lydia. Lydia. What's wrong?
I can't. I can't. My tummy hurts so bad.
Does this happen every month?
Yeah.
Every time you have your periods?
Yeah. I can't go to school. I can't work.
Huh. Do you have pain during sexual intercourse? When you're having sex? Why are you looking at me like that? No, I'm asking you this personal question not to interfere with your privacy, but because having pain or experiencing pain while having sex can be a sign of a particular disease that I want to talk about today. So stay tuned and we'll be right back. Hi everybody, it's your girl Lydia PC here, back again with another educational, motivational and inspiring video. If you're new to this channel, please feel welcome. I am glad to have you and I hope you will find my content encouraging as much as it has been inspiring to me and to my subscribers. And to you, my subscribers, I love you guys. Thank you so much. Continue sharing my videos. We are growing slowly and steadily and surely. So thank you so much. I appreciate your support. Okay, so a few months ago, I posted on my Instagram asking people what they would love me to talk about. And a lot of people say they want to know more about medicine. They want to understand the human body better. And this is perfect because, hey, I am in medical school and learning about the human body and how to be a doctor. And then a few weeks ago, I posted on my Instagram stories asking people, what medical topics would you like me to talk about? So thank you for those who responded. And majority of the responses, people suggested two concepts that they wanted to learn more about. And one of the top concepts was women's health. And I was like, this is perfect, because it's going to align with what I'll be learning in my final blog of my first year of medical school. Okay guys, so today I'm going to be talking about a disease called endometriosis. I know it's a long name, but you're going to understand this disease by the time we're done with this video. But before I talk about endometriosis, let me briefly mention that women between the age of 8, 9, 10, up to 45, 50, they bleed every month. And what happens is chemicals known as hormones are released in your body and they go to your uterus, the womb, and they trigger some changes there in preparation for pregnancy. So if a woman does not conceive or become pregnant, that tissue is usually shed in the form of blood, and those are what we call menses. Okay, so that is a perfectly normal process. Now, so that tissue specifically responds to those chemicals. And if that tissue grows in other parts of the body outside of the uterus or your womb, that is what we call endometriosis. It means the inner lining of the uterus, the endometrium, grows somewhere else in the body. And I'm going to explain to you using a picture how that happens and why it leads to the symptoms that some women usually experience during every month when they're having their menstrual period. Okay guys, so let's say this is your bladder, the pouch that carries urine. That's your urethra, the one that takes out urine. That's your vagina, that's your cervix. This is what dilates when a woman is about to give birth, and it leads to your uterus. That's where the baby is carried when one is pregnant. And this right here are your bowels. Okay, so what happens in endometriosis is that the tissue that usually lines the uterus in here, the womb where the baby is usually carried, grows somewhere else. So if it grows in the bladder or in the urethra, women usually experience pain with urination during their menstrual period. That is one of the symptoms of endometriosis. And then if it grows in the cervix or in the vagina, women can experience very painful sexual intercourse. So when someone is having sex, they experience a lot of pain because the tissue is growing here. And this is worse during the menstrual period. Okay, so in endometriosis, the tissue can also grow in the bowels. And when that happens, women can have diarrhea, constipation, or pain with bowel movement that worsens during their menstrual period. The most complicated symptom of endometriosis is when the tissue grows in your lungs, and this is called catamenial endometriosis. So the tissue is still sensitive to those chemicals we call hormones, all right? And so when you have your monthly period, those tissues begin to bleed as well. So usually patients can start coughing up blood when they have their menstrual period, or sometimes their lungs can collapse, and this can affect how you get your oxygen or your air. So some patients, when they have their monthly period, they usually sometimes have trouble catching air because their lungs have collapsed. You see how the medical dots are connecting here? So sometimes you can be having a woman's health issue that is affecting your lungs. So you have pulmonary issue. Or sometimes it can affect your bowels, like we talked about. So we are here connecting medical dots. And this is serious because endometriosis is a very underdiagnosed disease, meaning it can take years before a woman is truly diagnosed with the right condition. Okay, according to some sources in America, it can take up to 11 years for a woman to get a proper diagnosis of endometriosis. And in the UK, it can take up to 8 years for a woman to be diagnosed with endometriosis. But as you saw in the introductory video, I seemed to be in a lot of pain. These women suffer, but people do not get to the right diagnosis. And that is the purpose of this series called Medical Dots. I am here to help you connect those dots. So let's say you are experiencing these symptoms and your doctors have not diagnosed you. I highly encourage you again, go ahead and make an appointment with your doctor. Go and tell them you'd like to be evaluated, tell them what you're suffering from. And then I want you to listen to them first. They are experts. I'm just a medical student. But once they come with a diagnosis and you feel like you still have not been diagnosed well, then tell them, hey, I watched Lydia's video on YouTube and she was talking about a disease called endometriosis. Do you think that is something I might be suffering from? And your doctor might be like, that's a good point. Let me do further testing to make sure that's what you don't have. Or sometimes the doctor can be like, no, I don't think that is what you have. And that's perfectly okay because many other diseases can be presented with these symptoms. But I'm here to tell you that endometriosis also presents with pelvic pain, painful menses, pain during sexual intercourse, lower back pain, and this usually worsens during your menstrual period. So how can doctors know if you have endometriosis? So if a doctor decides to test you to rule out endometriosis, they can do a procedure called laparotomy, and this is where they insert tubes with cameras. They insert it into your abdomen and then they explore. It's like they're going on an adventure in your abdomen, and sometimes they can take a sample of the tissue. This is called a biopsy, and then they send it to the laboratory to be examined. And if the laboratory tests come back and show that you indeed have the uterine tissue growing outside of your uterus, then you're diagnosed with endometriosis. Okay, and sometimes they can also take a picture of your female organs using a machine called an ultrasound. So what happens, they insert the machine through your vagina, and then the machine uses waves to take a picture of your female organs, and they can use that picture to assess if they are seeing any abnormal tissue that is growing outside of the uterus. All right, guys, so now let's say you've been diagnosed with endometriosis. Then what happens? Unfortunately, there is no cure for endometriosis because we still don't know why the tissue that is supposed to be growing in your womb or your uterus grows somewhere else. And if we cannot identify what is the cause of the problem, then it is difficult to cure it. That's why we don't have a cure. But this is not the end of the world. If you have endometriosis, the doctors can help manage your symptoms and help prevent your symptoms from getting worse, okay? So first and foremost, they can treat your pain using pain medication. Secondly, they can put you on oral pills. We call them oral contraceptions. And what does, when you take these pills, they can prevent you from having monthly periods, and so they prevent you from having the symptoms of endometriosis. All right. So the other thing that can be done, and it's usually the last resort, it's surgery. And surgery is done for different reasons. One, it can be done to take out the tissue that is growing in other parts of the body. Sometimes they can just take out your uterus completely if it's so severe, so that you don't have monthly period. Sometimes they can just take out your ovaries, you know. So the surgery depends on how you present or what they find out in the imaging or the pictures that they take of your body. Okay, so one thing that I can tell you today as your friend, as your future doctor, is to prevent the symptoms from getting worse. Number one, exercise every day. 30 minutes of exercise go a long way. You don't have to go to the gym and lift weights. You don't have to go running in the field. Like for me, for instance, I enjoy dancing, and that's how I get my daily cardiac workout. All right. So if you enjoy dancing, do dance. If you enjoy walking, go and walk your dog outside, but get in your 30 minutes of exercise every day. Number two, a lot of people are not gonna love me for this, but I'm gonna tell you today to minimize your coffee. If you must drink some hot fluids in the morning, you can drink decaffeinated coffee. Or if you drink so much coffee, please limit that so that you don't have so much caffeine in your body, because this can worsen endometriosis symptoms. Number three, I talked about this in my previous video. Please watch how much alcohol you drink. You know, a lot of people drink alcohol, but they're not aware that they are in the dangerous or harmful category. Okay, guys. So what you see on the screen are the standardized drinks. So these are drinks that contain 14 grams of alcohol. It's not a matter of percentage, like 5%, 12%. No, it's these drinks on the screen contain 14 grams of alcohol, and this is the standard amount of alcohol according to the National Institute of Alcohol Abuse and Alcoholism. So what is the recommended amount of drinking? For whatever you see on the screen, if you are a woman or you're above the age of 65, you should not drink more than 3 standard drinks in one sitting, that is in one day, or more than 7 standard drinks in 1 week. If you are male, a man, you cannot drink more than 4 standard drinks or more than 14 standard drinks in a week. This is serious, because when you drink more than 14 drinks in a week for men, or more than 7 drinks in a week for women or people above the age of 65, you are at the higher risk category, and you don't want this. And especially if you're a woman, you need to reduce your alcohol intake, because it can worsen your female problems, including endometriosis. Okay, so as a quick recap, today we talked about endometriosis, and this is a disease that affects women. And what happens is the tissue that usually lines the inside of your womb or the uterus grows in other parts of your body. And so because this tissue is still sensitive to the chemicals that usually control the menstrual period, when it is time for your menstrual period, these tissues respond, and depending on where they are growing, you will experience symptoms. So if they're growing in your bowel, you have painful bowels, constipation, and diarrhea. If they're growing in your bladder, then you have pain while you're urinating. If these tissues grow in your vagina or your cervix, you have pain during sexual intercourse. If the tissue grows in your lungs, then you start coughing up blood, or you start having a collapsed lung every time you're having your menstrual period. And then of course you have a lot of pain because you have tissue growing outside where it's supposed to be, and then your body will react to it and cause inflammation, so it makes you very uncomfortable and in a lot of pain. And doctors can determine this by using cameras to evaluate your abdomen and other parts of your body. And also it can be treated by giving you pain medication, surgery, or oral contraception pills. I hope this makes sense. I hope you've been able to connect these medical dots. What questions do you have for me? Please feel free to comment down below and let me know. You can also message me on my Instagram, Twitter, Facebook. I use my official names, Lydian PC, so feel free to message me at any time or feel free to leave a comment down below. All right, I will highly appreciate it if you can please give a thumbs up if you liked this video, and please subscribe if you have not done so. Just log into Google using your Gmail account and then click on that red button right over there, and that will make you a member of my community. All right, guys, thank you so much and have a wonderful and blessed week. I love you all. Bye.